Kenya, like most countries in sub-Saharan Africa, is struggling with poor health outcomes and high loss of life due to HIV/AIDS. This is worsened by the country's critical shortage of health workers, especially those around HIV prevention care and treatment. After the promulgation of the Constitution, health services were devolved to the counties. This was a good thing. However, county HR officers lacked the requisite experience to manage health workers. We believe that by building their capacity in HR, the project would contribute towards improvement of access to HIV care and treatment services. This is where IntraHealth International comes in, through the HRH Capacity Bridge project, to contract health workers to serve in needy areas, to provide a conducive policy environment, including the sharing of specialists, collection and use of data for health workforce management, and building the capacity of the new HR officers in the counties.
The work is too much. If I wasn't here, my colleagues, they would be suffering because of the workload. You will be tired, stressed up. So the patient won't get that care they are supposed to get from you.
Following a freeze by the government of Kenya to recruit any civil servants, donors came around the table. They all responded to the government by supporting to contract health workers. Following USAID regulations, we opted to work with government. We used government structures to identify the gaps on the ground based on staffing needs assessment that was undertaken, undertake advertisement for the workers, hold interviews. Health workers were identified upon selection and subsequently deployed to the counties. We as IntraHealth, through the capacity project, were able to hire over 1,917 workers.
The ESP staff and other contracted staff that have been working with us have now been actually absorbed by the county health department. They are employed and they are now on our payroll.
The county government of Nyamira has successfully transitioned the entire 23 staff who are working under the Sustainable Health Workforce Program of IntraHealth into full, permanent and pensionable terms of the county public service.
Since the devolution, they have employed around 500 staffs, including those who are in capacity, ESP. They are also absorbed now after devolution.
There's also a scarcity in the country of specialists, oncologists, radiologists, anesthesiologists. Counties do not have resources for each one of them to recruit these cadres.
One of the things that we have been trying to pilot is how a specialist can support more than one county in a given specialty, and see how we can extend this to the others to improve quality of care and access to specialized health services.
The national government and IntraHealth developed National Human Resources for Health Interagency Coordination Framework.
We collaborated with the Moi Teaching and Referral Hospital, and we put a platform of teleradiology in our radiology department, whereby the images are taken and the operations are done by our radiographers, who transmit the images online to the radiologists who are in Eldoret, that's about 300 kilometers away, and they report back almost in real time. This has enabled us to reduce the number of referrals that we are making for CT scan services outside our county and indeed the region. We are now doing an average of about 6 to 7 CT scan tests per day. This is through interagency collaboration.
As county governments became employers of the health workers, it became critical that they do have a copy of the record of their workers. IntraHealth International did identify a platform known as the Integrated Human Resource Information System. IRIS is a tool for a HR manager or officer. This is an open source web-based system that can be modified. When the counties received the information, they were able to know who their workers were, what are their skills mix, what have they been trained on, and which facility are they currently working in.
Everybody was amazed with the kind of reports that were being actually produced. From the data itself, we are able to identify the gaps.
This one also help the county to prepare, how many people are retiring next year, how many do you need to employ, how many people need this particular training.
This was wonderful. There's no going back.
We knew the new HR officers in the counties could learn from HR experts in the private sector. So we paired them up.
Been working in the HR department now for 3 years. Due to the transitional period, everything was stopped. Things like going to training, promotions. So staffs were coming in complaining. I wanted to know how we can handle such cases. I was given a mentor, identified key areas where I wanted to learn.
She took on 3 critical areas that she felt she needed some mentoring. Performance and reward, training and development, and the third was to do with recruitment.
It was training me on how you can overcome when there is a problem, you seek for the solution. So through the mentorship program, I learned a lot.
So human resources is very core and very critical, and that is why we appreciate the partnership that we have been having with IntraHealth, especially through the Capacity Bridge project, to come up with solutions which will enable us to effectively manage and develop our human resource and also lay firm foundations as devolution takes root.
The services now are much better than they used to be before devolution. And because of that, our people don't walk long distances in search of health services. We keep listening to our people on how they want services delivered.